Hi, kitty cats. Have you accepted your gender doesn't match social expectations? Do you believe you deserve to live life on your terms instead of somebody else's? Then it might be time for medical gender transition. So let's talk about how to get started. I will talk about medical procedures, including surgery in this video, but first I want to make a broad statement about the phrase medical transition. As the counterpart to social gender transition, medical gender transition encompasses anything you can do that involves persistent modifications to your physical body, even if it doesn't require interaction with a medical professional. Actions you'll take during social gender transition, such as coming out to family or changing your name, are typically performed once and never revisited. But some actions you'll take during medical gender transition will be ongoing, possibly for the rest of your life. In some cases, there isn't a simple method to determine whether an action is social or medical, such as dyeing your hair or body hair removal, but don't worry about sticking what you do to transition into boxes. This is about you expressing who you are, and only you know what is important to you. So, let's talk about the most common aspects of medical gender transition to get you looking and feeling your very best. Talk therapy. The Western medical industry focuses on mitigating pathologies. That is, Western medicine tends to focus on fixing problems, not on the overall ongoing health of an individual. An unfortunate side effect of this focus is that you will need a diagnosis of something wrong, usually gender dysphoria, before you can begin some treatments that involve medical professionals. You typically must begin working with a mental health professional in order to access medical professionals. Now, this isn't always true. In the United States, some states practice informed consent healthcare, which means if you are informed of possible side effects of gender-affirming care and you consent to said side effects, you can begin the medical health care. Now, I know, the side effects of treatment are precisely what we want in medical gender transition. Having to label yourself with a pathological identity and give consent to express yourself in side effects is kind of insulting. So, I'm working on changing that. Obviously, talk therapy is not persistent body modification, but it is typically a necessary step 0 in medical gender transition. Hormone replacement therapy. Typically, hormone replacement therapy, or HRT, is the first step to medical gender transition. In fact, length of time on HRT is often a gateway to gender-affirming surgery. Many surgical clinics look for at least 1 year of HRT before even providing a consultation for surgery. Your results with HRT are going to be highly individual. You're shifting biochemistry that may never have been expressed before. The changes are going to be slow and subtle. Usually, the first result you notice is a sense of calm and clarity, which occurs within weeks of beginning HRT. Sometimes these changes in cognition alone are sufficient to alleviate gender dysphoria. You feel a greater sense of alignment with yourself. But HRT has long-term effects on secondary sex characteristics as well. You will experience a change in body and facial hair thickness and quality. You'll probably notice a change in skin quality and oils. You are likely to experience a change in body fat percent and body fat distribution, including breast development. And you may experience changes in muscle strength and size. HRT may also affect primary sex characteristics. Your libido may change, positively or negatively. And even the size of your primary sex characteristics may change, and your ability to climax during sexual contact may be affected. These are all long-term effects. Your body will change over 3 to 5 years or longer, and you may choose to undergo therapy for the rest of your life. Some of the changes brought on by HRT are reversible, so if you decide medical transition isn't for you, it's possible to back out of the changes simply by discontinuing HRT. But some changes will not be reversible, including breast bud development and facial hair development. Reversibility is part of the reason why HRT is considered a first step in a transition. Often you get time to determine how transition feels for you and where to go next. Like I said, HRT is slow and subtle, so sit back and be patient. Your genetics will determine how much your body changes, and if it's not enough for you, there are certainly more aggressive therapies. Nonsurgical physical modification. Before you take the leap into surgery, there are many options for expression that go beyond makeup and clothing. You may consider changing your hair, like bleaching or dyeing it, and maybe investigating the use of wigs or facial hair augmentation. You may also look into skin treatments to smooth or clear your skin. Dermabrasion may help speed up changes in skin quality, and even just getting a tan can change how you feel about yourself. You may also consider changing your hair, skin, and nails through nutrition or oils. Several companies offer serums to grow longer eyelashes or thicker eyebrows, and many options exist for reducing body hair and eyebrows, including waxing or electrical depilators. And of course, several prescription medications exist to encourage new hair, skin, or nail growth. Talk to your medical professional for more information on those treatments. These are procedures you're likely to do frequently. They are maintenance procedures and contribute to look and style. They are part of the experimentation you'll do to find how you like yourself best. Because many of the effects require maintenance, they are likely to be reversible if you don't like them. But if you really like them, it may be time to take that next step into more permanent changes. Hair removal and augmentation. Typically associated with feminization, hair removal or augmentation may also apply to masculinization. After all, if testosterone HRT affects you greatly, you may still want to make changes in your presentation. Body and facial hair can be permanently removed by laser hair removal or electrolysis. Laser hair removal involves being zapped with a laser that kills hair follicles by heating the hair inside it. That means the hair has to absorb the laser. The best candidates have fair skin and dark hair. Laser hair removal is a bulk process, and your whole body can be treated within a couple of hours. Electrolysis is more precise. It usually involves a similar process, heating the hair follicle to kill it. But unlike a laser, electrolysis uses a needle inserted into the skin. This approach means electrolysis works for any hair color, but it's also much slower and more painful. But let's say you're fine with hair removal. The hairline on your head can also be changed if HRT alone doesn't make sufficient changes. Surgical procedures to add hair plugs or stretch the entire skin of the scalp to move the hairline can help if you've lost any hair before beginning medical transition. All the techniques above are not necessarily maintenance procedures. They may take some time and healing, but can provide permanent hair removal or augmentation when done properly. But being permanent means these procedures are certainly more involved, physically, emotionally, and financially. Surgical procedures. The big guns of medical gender transition, gender-affirming surgery can make drastic changes to your physical appearance very quickly. I can't cover every surgery you will encounter. There is surgery for facial feminization or masculinization, breast removal or augmentation, fat removal or redistribution, and body implants to build curves or muscles. And of course, genital reconstruction to align your sense of self with how you engage in sexual contact. Plastic surgeons will perform many surgical procedures, but their willingness to recommend surgery doesn't require you to agree you need it. Before you engage in surgery, remember no human is perfect. Surgery to fix minor imperfections you didn't see until the surgeon pointed it out may not give you much reward. And it may go without saying, but I'm going to say it. Surgery is typically irreversible. Breast or other body implants can often be removed, but body parts cannot be restored. Surgical removal of ovaries or testicles will render you sterile, and there's no going back. Keep all of this in mind for your future and whether you want children. You may want to look into saving ova or sperm before you have gender-affirming surgery. Western medicine and reconstructive surgery can make the difference between feeling not enough like yourself and completing your sense of who you are. The gender-affirming surgery I received has been nothing short of life-altering, and I didn't expect that. But remember, you are not only your physical structure. You are a whole human, and surgery can affect only a part of that. Medical gender transition is, in part, a privilege. Some of us may never be able to afford much medical transition, but that doesn't make you any less transgender. I want to stress the importance of social gender transition, including name, pronouns, and look and style. Makeup, clothing, and behavior are frequently more important than medical procedures nobody ever sees in how you are perceived in your social environment. How you express yourself is very likely to evolve over the course of medical gender transition. Your priorities shift as your expression does. You have the rest of your life to determine your gender. Don't feel you have to check every box on somebody else's list in order to be real in who you are. All of the above depends on you. And if you realize you need help, reach out to me. I offer gender coaching services where we can discover your goals and develop a plan to reach them. The link above lets you book a free consultation. But then, like this video and subscribe to my channel to learn more about the art of being transgender. Talk soon. Bye!